Victoria Brown. I'm with the Volunteers in Medicine. I've been asked to come and speak with you this morning about our new walk-in clinic.
Good morning, I'm Linda Jackson. I'm the Executive Director of the Volunteers in Medicine Free Clinic, and we're here today to announce a new service at the clinic.
Good. Well, just carry on. We have a response to your comments, but if you'd like to just give us a couple minutes on,
Sure,
on
absolutely.
what's unique about this. Or,
You bet. And I know you have a big agenda, so I'll keep my, my comments brief. Thank you again for inviting us here today. The Volunteers in Medicine Clinic is located right down the street at 711 South 8th Street. Established in 2009, the clinic provides primary medical care to thousands of Lebanon County men and women without health insurance. The VIM model was founded in the early 1990s in Hilton Head, South Carolina, in response to a large uninsured population and also a large number of retired medical professionals. That's the model that we use at the clinic today. We currently have 8 volunteer doctors, 10 volunteer nurses, and a rotating number of administrative volunteers who assist with the day-to-day operations of the clinic. Each year, these volunteers contribute over $350,000 in professional services back to the community. Since our inception, we have provided care for over 4,000 uninsured patients, delivering over 50,000 office visits, prescription refills, and specialty referrals, combined with free diagnostic testing such as X-ray and labs. We estimate the value of these services each year to be in excess of $1.2 million back to the community. Today we're excited to announce that in addition to our traditional appointment-only medical care, we have launched this week a free walk-in, no appointment care. This was made possible through a grant from the Pennsylvania Department of Health. And with that grant, we've added 25 additional clinic hours. We've hired a nurse practitioner, a social worker, a certified medical interpreter, and a full-time medical assistant. The purpose of this grant is to provide and improve access to all Lebanon County residents who are seeking quality access to medical care, and also reduce the usage of the local emergency room for non-emergency illnesses and injuries. What's new about this program for us is that anyone can come to the walk-in. There is no qualification. It expands our services to include those patients who have Medicaid or high deductible commercial plans. They can come during our hours of Monday and Wednesday, noon to 8 p.m., and Fridays, 9 a.m. to 3 p.m. We did a little bit of research, and in conversations with the hospital, they told us that Sundays and Mondays were their high usage times for the local emergency room. So we try to match our hours to relieve some of that burden there. Now that also supplements our regular hours, which are Monday and Tuesday and Wednesday, 9 to 5. So we are now open 45 hours a week for medical visits.
That the Volunteers in Medicine offers such a great service to citizens of this county, and we do see very much need amongst people who are working for the most part, sometimes 2 jobs, sometimes more jobs, and some can't even take care of their own basic needs, such as insulin or hypertensive medications. So it's my joy to be able to work in a place that can help people who are trying to help themselves, and to support the county in its effort to unload burden on the emergency room that's really not the best usage of funds or resources. So thank you for allowing me to.
being in your 6th year or whatever, most of the support has come from the community to run this thing. That's why you're able to offer free services, except for this grant, which is a new feature for the clinic. So that's good.
Could I clarify? Are you open Sunday or no?
We are not. We are not. Currently,
Okay.
we are not open on weekends.
Okay.
It's a 21-month grant. It was just a little bit over $300,000.
And was there a match involved?
There was a match. There was a 25% match.
Thank you for the services that you provide to folks in the county, and I know firsthand that we've helped some folks that I've sent there, and appreciate that, and it's really a niche, as the doctor already said. These are folks, for the most part, that are working, have a job, but the cost of health care today, we know it. There's no free health care, and it has to come from somewhere, so I think.
And if I could just add one comment, the free walk-in model is very, very unique. There are few free clinics that offer this service.
Sure.
So I think Lebanon County is offering a very new and innovative form of healthcare delivery. Yeah, well, we will go back to the Department of Health. There are many clinics who are funded for their programs year after year, and with the success of this program, we feel pretty confident that we can go back and make a strong case to the Department of Health that they should continue funding this program.
Founded in 2009, Lebanon Valley Volunteers in Medicine is an incorporated nonprofit organization which was established to provide free medical care to Lebanon County residents. And whereas, taken from a successful group model, Lebanon Valley Volunteers in Medicine is staffed primarily by skilled and friendly volunteers who give of their time without compensation. And whereas access to health care consistently ranks as one of the top problems in Lebanon County, as many of our residents continue to struggle finding attainable care for their needs. And whereas, whether uninsured or underinsured, Volunteers in Medicine Free Health Clinic provides care to individuals age 18 and older who are completely without health insurance. And whereas, currently, VIM has provided free medical care to over 4,000 patients utilizing volunteer doctors and nurses. These physicians and nurses provide over 7,500 free patient visits each year, and the value of their service to the Lebanon community exceeds $1.2 million. And whereas, during the month of February 2016, Volunteers in Medicine will add 25 additional free clinic hours per week to meet the needs of patients who do not have an appointment and alleviate pressure for emergency room care. Now therefore, we, the Commissioners of Lebanon County, on behalf of all our citizens, take this opportunity to recognize Lebanon Valley Volunteers in Medicine for being one of only a few free clinics nationwide to offer free walk-in health care for the residents of Lebanon County.